so we're gonna go ahead and get started. Thank you all for coming, especially folks from the 7th and 8th floor that never came here. See, there's good people here, you can keep coming. We're really delighted that today we have Dr. Abdisalan Noor, who is a visiting professor at IIG and GHB. He sits right here on this floor over there. And will be spending 1, maybe 2 years with us. But Dr. Noor served about 7 years at the Global Malaria Program. So we could not have a best speaker to talk to us about malaria. And today you're going to talk about climate change as well. So welcome, Noor. We're all looking forward to your talk.
Thanks, Marcia. I should declare right from the start that I'm not a climate scientist. I'm a malaria epidemiologist, but have been interested in malaria and climate change for a number of years, and most recently was responsible for pulling together a chapter for the upcoming World Malaria Report on climate change and malaria. So what you will see today is a snapshot of an evolving chapter that will be published in the next month when the report is launched at the beginning of December. Before I delve into my talk, I wanted to know who I'm speaking to and their views on climate change and malaria. So I'll ask a couple of questions. Who thinks that climate change is going to lead to a malaria pandemic? Who thinks it's not going to make a difference? Who thinks it will make a difference? It will have a negative impact.
Negative impact?
Good. Well,
Negative, which way is negative? Malaria or bad for people?
it's definitely bad for people. Do you think it's going to lead to an increase in malaria, if not a pandemic? Good. So you will have seen, if you are interested in this topic, a lot of news articles that have come out in the last 6-12 months. Well, as I was saying, over the last 6 to 12 months, those of you who are interested in climate change and its effects on malaria would have seen a lot of high-profile news articles, all of them in the lead up to the COP28, all of them highlighting the major risk that climate change poses to malaria and other vector-borne diseases. And many of them somewhat definitive that it's going to lead to a major malaria crisis. What I would like to do today is basically tackle some of those perceptions, hopefully with some level of evidence, and explore the potential pathways in which climate change may affect malaria and what globally we can do in terms of responding to the threat climate change poses and the threats that more globally malaria we face in the malaria response. To give a bit of context, malaria still has a wide geographic range in most of the continents, except in the European continent that reported its last indigenous case in 2015 and will soon be certified by the WHO regionally as malaria-free. But if you look at the number of countries that are considered malaria endemic, we've had about 105 countries in 2000. And today we have 83 countries. And of course, climate change has been happening in that period, has had significant consequences on society already, particularly those in low and middle income countries. But at the same time, we've been seeing progress against malaria. And if you look at the trends, in 2000, we had about 27 countries that had less than 10,000 cases. Today, we have almost 20 additional countries with less than 10,000 cases. If you look at incidence and mortality, and most of this is contributed to by Africa, we've had, again, a considerable reduction, not as fast as the reduction we see in mortality, but a considerable reduction in incidence and a rather impressive reduction in mortality by nearly half, 50%. Even though in the last few years, we've had a slowing down of the progress, before the pandemic, made worse by the pandemic. So we've been having progress against malaria with imperfect tools in imperfect health systems under an era of climate change. So that's the context within which we're working. This doesn't mean climate change is a good thing for malaria, but it's something we can ignore in our global response against malaria. So today I would like to take you through a series of slides that present with this outline. First, I would like to tackle the whole issue of climate and malaria, because many of us who have been trained in malaria, we implicitly feel that we understand the relationship between climate indicators and malaria. Even though some of the science is well established, there's a lot of gaps in knowledge, in the basic interaction between climate and malaria. Then quickly go into climate change predictions. I'm not a climate scientist, so what I will present to you is what is in the IPCC. Many of you may have seen that. Then I look at climate change and malaria, particularly at the conceptual level. What are the ways in which, all things considered, climate change may affect malaria transmission and malaria burden? Then I'll go into the state of evidence. And what you'll soon realize is there has been some interesting work, but there are also huge gaps in the evidence. And finally, conclude this session on what globally we can do realistically in terms of responding to the climate change threat. So, from a direct effect perspective, climate does influence the life cycle of the mosquito and also influences the development of the parasite within the mosquito. So those are the two distinct pathways in which it influences the vectorial capacity and hence influences malaria transmission. So more specifically, we're talking about larval development, including pupae development, mosquito survival, mosquito biting rates, the human biting rates, the holotropic cycle, and the parasite development cycle spoken. These are all sensitive to temperature variations and its correlations with variations in precipitation and humidity. So all of those three factors combined do influence a lot of these metrics. Collectively, they influence vector competence and bacterial capacity and hence influence malaria transmission. For example, we have, if you have temperature ranges of between 10 and 12 days on average, larvae survive less than 7 days. If you have 14 to 20 degrees, they might survive up to 30 days. Then so on and so forth. Mosquito have optimum survival temperature. They also have optimum temperatures for biting and various adaptations within that range of temperature. In terms of parasite development, you have the famous de Tinovas model, which kind of elucidated the whole degree day model and various improvements on that approach with an optimum range of 16 to 30% in terms of what's considered to be the right temperature range for parasite development and a high level of attrition in parasite development rates beyond certain temperatures and below certain temperatures. So there are many studies that look at this relationship, but the one that I found most useful because it builds on the de Tinovas, then builds on work done by others such as Mordecai, is the publication by Shapiro and others looking at these relationships. And what you can see, whether we're talking about the biting rate, the vector competency, daily mortality rates, the parasite development rates, all of them have an element of nonlinearity and a strong temperature dependency. So all things considered, if these temperature thresholds change, we expect malaria transmission to be affected, theoretically. And so that's why there's a strong concern around the relationship between climate change and temperature in the direct sense. What does climate change prediction look like? You'll be familiar with this graph, which essentially simulates what will happen in 2100. relative to the baseline of 1850 to 1800, and you can see a warming world, some places a drying world, and in some places a world that's becoming wetter. And so it's under these kind of mindset and these projections that the concerns around climate change and malaria and other vector-borne diseases emerge. Now, the IPCC uses different scenarios to build, to kind of project what may happen under different climate scenarios. And they call these the shared socioeconomic pathways. They have 1 to 5. And the SSP1, the only one that's leading to temperatures around 1.5 degree increase to slightly below that by 2100. All of the others lead to high levels of projected temperature increases. But SSP2 is considered the middle of the road scenario, which is expected to align with a mixed level of mitigation, but nonetheless a strong level of mitigation. While SSP5 is kind of the hit the highway scenario, which is essentially the worst case scenario. And all of these have different projections when it comes to the climatic indicators. Temperature getting really terrible under the SSP5, not good in all the scenarios except SSP1 best. But nonetheless, the realistic expectation being what will happen under SSP2. Precipitation changes, again, variable by SSP, and so on and so forth. So there's also projections that extreme weather events will increase, not just in magnitude, but also in frequency. And these weather events are not just the wet weather events, but also the dry weather events and droughts. And this is just a summary from the latest assessment report looking at the different observed weather events and the projected contribution of climate change to those weather events from the latest IPCC report. This, as we shall see shortly, is important to malaria response, and we have examples of where extreme weather events have recently led to catastrophic increases in malaria. In addition to the extreme weather events, there is some evidence that the length of seasonality will also be affected. And the importance of the length of seasonality, for those of you who are familiar with malaria, is that you have an increased window in which transmission occurs, but also has implications for the interventions against malaria, such as seasonal malaria chemoprevention, and how long you put that into a community. So, quickly, I have gone through climate and malaria. It's a very complex subject in terms of the relationship between climatic indicators and malaria. I've just given you the highlights. I've also quickly gone through the climate change predictions. And in my next set of slides, I want to go through what these effects are likely going to be conceptually. And it's important to emphasize that these are just conceptual pathways because we do not have evidence or in the empirical sense of how all of these pathways have been realized or are going to be realized. So let's start with the direct effects. And when I say direct effects are those that have direct implications for malaria transmission. The indirect effects are those that have indirect implications, either through increased burden and at the same level of transmission, or through interference with the ability to respond to malaria. So there is a general acceptance that the increased temperatures is going to expand the limits of malaria transmission. And the thinking behind this is if we have places that have below the threshold temperatures for malaria transmission, and you increase that by 1 or 2 degrees, you're going to put them in that threshold of malaria, the range of malaria transmission, and therefore increase the suitability of those environments for malaria transmission. A good example where the evidence is perhaps the strongest is in the African highlands. Now, as you think about the consequences of increasing range, particularly in the fringes of malaria transmission, I also would like you to think about where these places are and what their socioeconomic and development status is going to look like. Because there is the forcing climate factor there's also the anthropogenic factors around socioeconomic development that have a different opposing effect in some instances on malaria transmission. That said, I think there's evidence that on the margins of malaria endemicity, climate change could lead to expansion of the geographic range. And the consequences will be people who are non-immune are exposed to malaria epidemics occur. Among the factors that will influence, in addition to the increases in temperature, the factors that will influence the consequences are the levels of parasite importation. So if you have a temperate region surrounded by endemic areas, that is at a greater risk of epidemics than a temperate region that may experience an increased climate, has low importation rate, is very distant from an endemic area. So the second direct effect will be increasing transmission intensity within current limits of transmission. So there are places, if you had seen, closely looked at the curves, there's a nonlinear relationship between the indicators of bacterial capacity and temperature. And if there are places that are kind of on the lower side in terms of lower temperature threshold, but within the ambient range, if you see increases, even though they're already within the ambient range of transmission, if you see an additional 1 or 2 degrees, it takes them towards the optimum levels of transmission. So an increase can happen in those areas, even though the geographic extent doesn't necessarily expand. Decreasing transmission within the current limits of malaria transmission. There are places that are again on the other right side of the optimum temperature range. And if you put an additional 1 or 2 degrees, you put them beyond 28 degrees, potentially increased mortality of the vector, the increased dryness, reduction in malaria transmission. So you also have that effect conceptually. And there are places where it might not make such a big difference because they're already within a range where an additional 1 or 2 degrees may not flip things considerably. But this does not imply that a rise in temperature change will have a negligible effect, particularly on the burden of malaria, because of the indirect consequences. And these indirect consequences, again, there are many, but perhaps the most consequential is a loss of livelihoods. This is already happening in many malaria endemic communities. They're getting poorer, their agricultural output is declining, their livestock is dying, their nutrition levels are going down, and therefore, even though there isn't any perceptible change in malaria transmission, their ability to cope with the disease is being diminished, which means they're going to lead to more severe disease, they're going to lead to more deaths, they're going to have situations where people cannot access care. It doesn't necessarily apply specifically to malaria, it just applies to all of health. It has significant consequences to the malaria response. Displacement and service disruptions. Again, there is ample literature on the consequences of climate change and displacement. Lots of people from malaria endemic countries live in Africa, going off to Europe and other places. Displacement within Africa itself, high levels of rural-urban migration. All of these, again, if, for example, within malaria endemic countries, you have, because of climate change, high level of rural-urban migration, you're introducing more malaria in urban areas, in potentially non-immune populations, and potentially lead to epidemics. Displacement of non-immune rural populations into places where there's malaria also could lead, just within rural to rural migration, could lead to epidemics. Access to care and the quality of care can be impaired in many ways, depending on the level of disruption that climate change has caused, whether it is related to treatment seeking, commodity supplies and damage to infrastructure, particularly under extreme weather events, the quality and stability of medical products that are temperature sensitive, the workforce, the health of the workforce, and overall health system and its capacity to carry the overall health impact of climate change. Because if you have already weak systems that are coping with a lot of vector-borne diseases that are sensitive to climate, but also trying to address the needs of a variety of other communicable and non-communicable diseases, any increase in the burden of malaria, for example, in these areas, will put a lot of pressure on the health system. At the same time, climate change is affecting many other diseases. So you have potential overwhelming of the health system. again, the evidence for all of these points I'm raising is variable, and in most cases it's absent. But these are just the conceptual ways in which this could work. And perhaps the strongest evidence comes in the increased cost of the response. If you have an extreme weather event, everything becomes very difficult, everything becomes very expensive, whether you're responding to malaria or you're responding to cholera outbreak. And that increases the cost of the response. It also has consequences on the cost of supply chains. So this is a summary of the direct and the indirect effects. I'll then go to the state of the evidence. As I said earlier, the strongest evidence of the additive effect of climate change to malaria transmission comes from the highlands. Now, conceptually, if everything else remains constant, any change in temperature, precipitation, rainfall that increases the suitability of malaria transmission inevitably will lead to increase in malaria transmission. But the operative word here, phrase is other factors remaining constant, because malaria intervention, socioeconomic development, all of these things play within that complex system that responds dynamically to many other determinants, many of which are poorly understood in terms of their relationship in the dynamic sense. Even less well researched is how the non-transmission factors affect malaria transmission, whether this is health system factors, urbanization, socioeconomic development, and how these interact with climate change. Strongest evidence comes from the African highlands. These are on the fringes of malaria transmission, and this data suggests that there has been an effect on malaria due to climate change. At the regional level, I would like to reflect on two pieces of work. One by Carlson and colleagues that has used data that we, myself, Bob and Bob Snow and others have put out there through a paper that we published in Nature of long-term parasite prevalence survey data from the 1900s at the beginning of the century all the way to a 100-year period. And Carlson and others took these on. Essentially what this demonstrates is the observed malaria prevalence from 1900 to 2015 at the polygon level by the different African regions. And a couple of things to point out is that you will see that in the historical period, there's hardly any data. Very, very, very few data points. And this poses a really important challenge when you're trying to infer the relationship between historical malaria transmission and climate change and climatic factors. The other things you note is that the first pink bar and the second pink bar represent the 1955-69 Global Malaria Eradication Plan, and this one is since the period 2000, since the rollback malaria area and the global technical strategy. And so this is observed data. They tried to then look at the estimates of prevalent climate relationships in the period 1900 all the way to 2100 using that data and climatic data that they have assembled. One of the things I like about this study is the way, because it was done by climate scientists, is the way it frames the climate question. However, as will soon emerge, one of its major limitations is that it doesn't have the right epidemiological nuance, particularly when it comes to the relationship between interventions and malaria transmission. And so anyway, they look at the relationships between prevalence and climate using that historical data across different climatic scenarios. For example, the first one is the estimated relationship between temperature and prevalence, the effects of extreme precipitation events, P and C, whether they're wet or dry events, and then the predicted change in prevalence attributable to climate change in the recent past. So they look at the historical period and then they infer the period after that. Historical changes in malaria prevalence attributable to climate change, they take the data that they had, and they start looking at what proportion of the trends they saw was attributed to climate change. As you can see, it's very variable depending on which region in Africa you are in. In West Africa, it reduces. or there has been a reducing effect on malaria transmission. In Southern Africa, which is on the fringes of transmission, epidemic-prone areas, there's been an increasing effect. The same with East Africa, largely driven by the East African highlands, and hardly any change in Central Africa. And then they project this forward to try and look at what will happen in the future, which kind of aligns with their historical relationships and under the different SSP scenarios. The main message that that comes out of this paper is that the effect is variable. In Central Africa, there will be hardly any effect. In West Africa, perhaps because of the drying of some parts of West Africa, there is a reducing effect. In East and Central Africa, Southern Africa, particularly in the highlands, there is an increasing effect. So highly variable between regions and varies in direction as well. So before I go into the next study, there are a number of key points that I'd like to show here. One of the biggest limitations to my mind, in addition to the fact that there's very little data historically, is that their entire intervention consideration is whether the data point falls within an intervention period or not. There wasn't an actual input in terms of the coverage of the different interventions. And for those of us who work in malaria, we know how sensitive malaria transmission is to the actual population who are protected by specific interventions. You can't just have a dummy variable and say I've accounted for the effect of transmission. And then we move on to the next study, which is a study that was done for the WHO Strategic Advisory Group, which essentially looks at what will happen under the SSP2 and SSP5 scenarios if under different socioeconomic scenarios as well as different intervention scenarios. The main message that comes out of this analysis, first presentation here is on SSP2, is that even with the current levels of malaria control, if we maintain that, we'll still see a slight reduction in incidence, no change in cases, largely because of the reduction being countered by the increase in population. However, if we scale up the current control or add innovative tools, whether these are vaccines or monoclonal antibodies, you will see a significant impact under SSP2. And this includes urbanization and other socioeconomic changes. Now, if you look at SSP5, which is your worst case climate scenario, under the current control, we are not going to make any progress in incidence, and cases will shoot up dramatically by nearly 100 million additional cases by 2050. However, if we expand our control considerably, even with the current tools, we will mitigate that. If we add the innovative tools, we're likely to get to eradication levels in both scenarios, much more so under SSP2. The main limitation of this study, of course, is the assumption, also in the previous study, that the relationship between environmental conditions and malaria transmission, modulated by interventions and other anthropogenic factors, will remain constant. But we know that the parasite changes, the vector behavior changes, human behavior changes, and that is very hard to predict. So what do we do in terms of response? And this brings me to my last slide. So those who are sleeping can wake up. This potentially requires a book, but I only have one slide for it. And the reason is it's actually a very hard thing for a typical health system or a malaria program to try and develop a strategy to respond to climate change in the long term. It's just very difficult because their response is today, tomorrow, next month, next year. And so they respond to climatic variations, whether they're due to this natural climatic variations or due to climate change. It doesn't matter to them. What they respond to is, am I going to have more than normal rainfall? Do I expect an El Nino period? Do I expect a La Nina period? Are there going to be floods? Those are the things they respond to. But there are ways of looking beyond that. And the response that we propose in the upcoming report are around 5 domains. One is the strategic space. And the first recommendation here is to try and bring the community together to have a common voice. Because what's happening is everybody has harped on a specific narrative, and there's lots of mixed messaging coming out from the malaria world, and it's very difficult for countries to understand which way to go. The second thing is, if you're really worried about malaria and a changing climate, your first responsibility is to try and get rid of malaria as a malaria person. At the same time, we have a collective responsibility to mitigate the effects of climate change, both in increasing temperatures, but also in adapting to those increases. So you have to do that in parallel. There's a need to decarbonize health systems, not just malaria, but across the board, because they are contributors to global warming to a certain effect. If you look at from the factory to the point of care, and most importantly, shifting the locus of decision making. Today, in the narrative of climate change, in the narrative of global health, a lot of the thinking, a lot of the decisions, a lot of the strategies are still very much top down. The consequences are at the local level. The most affected countries will be the low and middle income countries. Whether you are in the IPCC domain or in the malaria global health domain, the decision making is still asymmetric, and you are not going to achieve great success without making some level of equilibrium there. There are some technical issues. As you would have seen in the two analyses that I presented, the first one was done by climate scientists with very little input from epidemiologists. The second one was done by epidemiologists with very little input from climate scientists. And so what you end up is the analysis subjectively designed with the mindset and the skill set of the people who are doing it. And so there's real need to close that bridge and to better collaborate on this. You will hear this a lot of times, whether it's in malaria and other spaces, climate resilient and environmentally sustainable health systems. I still don't know what that actually means. But that's something you have to put in the recommendations if you're WHO. Guidance and tools for monitoring climate and health. There's a lot of this that is missing. There's lots of guidance on what's needed in the climate space, lots of guidance on what's needed in the malaria space, very little in terms of what's needed jointly. Operationally, countries, if you go to a malaria program, there's really no capacity or understanding of how to use the epidemiological data with the climate data, how to anticipate epidemics, how to plan for those. There's very limited capacity in many, many settings. That is essential. R&D, there are a number of things that are happening. First of all, our tools, which are already imperfect, are facing biological threats, which means their utility is diminishing. So even without the nuisance of climate change, and it's not a nuisance, it's a major risk, we'll be dealing with a significant problem. You add that to the climate change problem, you're having a bit of a crisis in terms of how best to respond to malaria. So we need to mitigate the biological threats, but we clearly need an eradication tool or set of eradication tools. Whether these are vaccines or other things, I don't know. But we definitely need this for us to really hit malaria hard. Funding is a really big challenge. Again, it's a challenge across global health. In malaria, there has been a $50 billion investment over the last 23 years, but that funding has plateaued. Sub-Saharan Africa has increased from 2000 to 2020 by an additional 600 million people, nearly doubling. And so while the commodities are getting expensive, you have population increasing, you have the efficacy declining, and even though funding, it's admirable that funding has been sustained under extreme challenges, what that dollar buys you is declining. And so you have a difficulty in that space, and increased funding becomes important. In fact, from a political perspective, one of the reasons why the malaria community is now very vocal about climate change doesn't have to do with any new realization that climate change is a major threat to malaria. It's that there is going to be funding diversion to climate change mitigation. The malaria community and all other disease communities want to tap into that resource. So that's why a lot of this is really happening from a political perspective. So I'll stop there for now. Thank you very much.
Thank you, Noor. So, questions?
So as you go through those studies and the sort of things get hotter, drier, decompensate, do you think there are major variables in the effects of climate in health systems that have not been articulated and incorporated into those models?
Yes. The short answer is yes. They are. The big thing that's not understood well is if climate change is going to have such a big impact on society, on economies, on the social fabric, on livelihoods, how does that affect health systems, capacities of government to fund health systems, and therefore the resilience of the health system? Just understanding that itself is complex. Then translating that to how it's going to affect malaria becomes even more complex. So the short answer is yes. The difficulty is that I don't see us getting to grips with that particular problem in a scalable way.
Okay, we have one question online from Fredos. So Fredos, do you want to unmute yourself and ask the question?
Yes, indeed. Fantastic talk, Professor Noor. This is great. I think it's the first time for me to see a collation of this evidence for malaria specifically. So thank you so much. Two quick questions, really. The first one is, you gave this example from one of the publications about places in West Africa having less malaria as a result of climate change at a fairly broader scale. Do you have examples where such a reduction of malaria would actually happen in other places in the tropics? Is that anything that we could expect? And the second one, at the very end of your talk, you were saying that the malaria community is hoping to tap into some of the financing available for climate. Can you give some examples of how exactly this would be, or what kind of financing scheme, for example, might be available here? Back to you. Thank you so much.
Thanks, Fredros. I don't have an answer for your second question. So I'll answer your first question. The fact that climate change is going to reduce malaria in certain parts of malaria endemic world should not be seen as a positive outcome. And that's the first statement I would like to make, because that is happening because the environment is getting drier. It's more frequent drought. And that has potentially even more severe consequences than the marginal increase that will have occurred due to climate change in some of those settings. So there would be pockets in other places outside of West Africa where that is potentially happening, but it's not the kind of message that actually I'll see as a positive outcome, because to my mind, the indirect consequences are much more severe than the direct consequences. And that reduction is because of the drying of the environment, therefore there's a direct consequence element, but it's associated with a lot of suffering outside of what happens in the malaria space.
Noor, what do you think about mosquitoes adapting? Or maybe Famini will answer this, but I mean, you're assuming with this analysis that mosquitoes are going to keep the same properties, but as we know, adaptation, particularly where survival is involved, is a big issue. So could there be other species that all of a sudden take over the majority of the transmission?
I will be very hesitant to say anything etymological with Flamini in the room. I had, after I submitted the slides to Jessica, I had a bit of a thought, and I had put under the indirect effects something on the vector behavior change and human behavior change, because humans also have to adapt.
Yeah.
Right? It gets hotter, you have to spend more time outside, that might expose you more than usual. You cannot use your bed nets, etc., etc. Yes, and in fact, there's some evidence that as even outside of climate change, as the microclimate changes, that's associated with vector behavioral change, and at scale that might replicate. But I don't know of how what's going to happen in the different spaces, with the different vectors. I would say in terms of a new vector, I'm one of those people who doesn't believe that, for example, the expansion of Stevensa has anything to do with climate change. I could be wrong. I just think it's got something to do with mobility and connectivity increasing. And we also forget the places where we find, for example, between Djibouti and Yemen, over the sea, you have 28 kilometers. Djibouti is closer to Yemen than it is to Nairobi. And they have been trading for the last 1500 years. So, but there is again the possibility of new invasive species dominating certain places. There's already studies coming out because of the pressure of the intervention, Funestas dominating some parts of East Africa, and I think Fredros was involved with that. I would like to know if there's any thinking around whether that dominance of Funestas is not purely interventional, and it might have something to do with the environment, climate change.
Yeah, and Funestas are, I mean, Fredros might correct me if I'm wrong, but I think Funestas is one of those factors that is well adapted to drier climates. Yeah, so yes, it will be definitely adaptations of those species.
Yeah, quick one, and then I'll take questions online. Go ahead.
Yeah, okay. So, really interesting. So, thanks so much.
Thank you, Professor.
You're welcome.
Thanks, Professor.
Just wait a second, Steve.
Okay. Okay, thanks, Professor Noor. This is Stephen Munga from Cambridge. I just wanted to make a comment that one of the areas that you're likely to see a reduction in malaria with the increasing temperature. Actually, we're seeing that in one of the areas that we work with. We are working in Siaya in Western Kenya.
Thanks, Steve. Is that
right
because of other reasons or because of climate change?
It's basically weather changes, climate variability.
All right, thank you. Flamini.
Yes, I was very interested by the predicted decline in malaria cases, leading even to eradication, with an increase in control strategies. Yeah, and I wonder whether this is dependent on actually climate change happening, or it will happen regardless, if there was an increase in control strategies. But also, to what extent this expansion of actual every control tool will need to happen?
So, two things to note is that there is an inbuilt assumption that before even we go to the scaling of innovative tools, that our levels of effective coverage for both prevention and case management will go to 80% effective coverage. Now, 80% effective coverage, for those who may not know, is not just 80% of the population have a bed net or sleep under bed net. 80% of the population are protected, use the bed net at the times when they are likely to be exposed to the vector. So you have that effective coverage. For case management is the same. You have to include compliance and all of that in terms of completing the treatment and not just access to the treatment itself. So there's a very high burden for control that has been set.
What is it now?
Now no one knows the effective coverage. We know it's well below the reported population coverage. Yeah. So for example, if you take your average bed net, the effective coverage, the lifespan of a bed net between two campaigns is about 2 years or less. The effective coverage is estimated to be half what's expected. But you only have about half of the population protected with a bed net. So you add all of that, you really don't have much of an effective coverage in the prevention side. Then you start hypothesizing about innovative tools that monoclonal antibodies will work wonderfully, that we will have a really good vaccine. And so there's a lot of this that is really very hopeful. realistically, what will happen with an enhanced control with the current interventions is not to get to 80% effective coverage, maybe 50 to 60% effective coverage. It's somewhere here.
Okay, let's take another one online. Kingdom, you want to unmute yourself? Yeah.
Thank you, Professor Noor. And I guess it's good evening. For me, I joined from South Africa. My question is about the last slide. So in the context of finding diversion. Now, as it's a well-established point that climate change increases the intensity and the range of malaria transmission as the SDG 13. My question is, with all the publicity, as you have shown with the media clips in your early presentation, and most recently the Washington Post and others, and also with these global health priorities, for example, the WHO, GTS, SDG 3, 13, 17, and lastly, lobbying and advocacy for resources. What will it take for the climate change community to realize that their current siloed approach of reserving funding exclusively for climate change instead of creating synergies with malaria is ineffective? And perhaps maybe the WHO or any other body can be the arbiter. So that's just a question. Thank you.
Thank you. First of all, I would like to emphasize that the Washington Post isn't a primary source of scientific evidence. And the reason I say this is we really, as I was presenting, I was trying to be balanced. Some places will go up, some places will remain the same, some places will go down. But climate change will not be a good thing for humanity, and therefore it's not good for malaria, whether it has an increasing or decreasing effect on transmission. That said, the siloed nature of global funding, whether it is to malaria, to HIV, AIDS, TB, or climate change, is something that isn't specific to the climate change funding. A lot of global funding for responding to global health threats or global emergencies are siloed. And I think I don't have any good ideas for you in terms of how to create better synergies, but I do think that there's enough momentum around the need to create better synergies. And that we don't end up in a situation where the health response in climate change is driven by climate change advocates or scientists, and should be driven by the health and public health people, but in collaboration and working with the climate change people.
And along those lines, the copy 28 this year is the first one that will have an entire day dedicated to health.
Yes.
First ever, which says a lot,
And-
right?
And that's where the malaria.
Yes.
Exactly. Yes.
Yeah, so I guess based on that and also some of the events that some of the Harvard delegation for COP28 are trying to put together, are trying to bring together the UNFCCC people with the IPCC people, with the WHO people, and have people together. And I'm curious what you think the message should be from the epidemiology side on motivating the use of the loss and damage fund to support healthcare systems or to support malaria control programs, or where you think sort of what the message should be from the epidemiology side.
I think there are two strands of messaging there being pushed. The first one is it's going to be a major problem for malaria, and therefore money should come from the environmental climate change kitty to those people who fund malaria response. The merit of that, I don't know, because then that assumes there is this strong evidence of direct effect. And that it also assumes that that response is going to mitigate the effect of climate change on the malaria response. My preference would be to look at climate change effect on health and humanity more broadly, and to try and identify the critical leverage points and see how that's going to work. If investment in socioeconomic development or investment in ensuring greater infrastructure development is going to indirectly lead to a bigger impact on malaria, as opposed to direct malaria funding that may lead to increased coverage of bed nets, for example, or other interventions, but will have a much lower impact on overall burden of disease, then it makes sense to do it indirectly. But the politics are a little tenuous. I would say, from a diplomatic perspective, there's need to definitely increase the budget allocated to malaria. There's need to make sure that any investment that goes into broad vector control response in the climate change funding is synergistic with the malaria response.
Okay, there's another question from Fredos, which is, what steps do we need to generate greater evidence at the local level? What kind of evidence should we prioritize?
I think, first of all, as you would have seen, the most reliable epidemiological data for malaria to tease out what is happening is the parasite prevalence data. All of those are direct investments parallel to the system in community surveys by external actors across the last 100 years. They have very little to do with data generated from the health system, but they're still imperfect. Now you go to the surveillance systems in the health system, the epi data is even worse. So there's really need to invest in the surveillance systems for health, not just for malaria, for health. The other aspect that is missing, if we had good entomological data that then links to good climate data, we would be in a stronger position to say something about what's happening. And so if I was thinking with a malaria hat, I'll say disease surveillance, entomological surveillance, climate surveillance.
Back to the base. Is there a question in the room? Yes.
Yeah, I wanted to sort of pick up on the amount of money, because, and there's a two-part element to this, but obviously there's a whole bunch of very pressing health issues out there, and every health group says we just need more money. So do you have a sense, for instance, I mean, presumably there is a correlation between the MDGs moving to the SDGs and seeing a diminishing in the political awareness around malaria and the focus, which is then contributing to the funding. So do you have a sense of what needs to be rectified in that regard? And the other sort of related element to this is that can climate change to some extent be seen as a positive? Because historically, of course, malaria has always been sort of viewed as a problem for low and middle income countries, and high income countries have eliminated it. So in the event that we start to see more malaria turning up in high income countries as a result of climate change, can this actually be used as a political catalyst to then increase your funding request?
So yes, in a bit of a cynical way, I suppose you're not about to be two questions.
I'm a political scientist, so cynicism is part of me.
So the thing, I'm a bit of a skeptic when it comes to climate change leading to malaria transmission in highly developed settings, simply because of the basic, the mosquito needs to find a place to live, right? And you need to have lots of people with parasites to sustain its infectivity, the infectiousness and infectivity. And so unless there's a dramatic shift in population movement and a dramatic collapse in the maintenance of the environment in rich countries, I don't think there will be a major upsurge of malaria in developed countries. That's my view. Could be wrong. But if that is a language that can be used to shake down a few dollars for the malaria investment, I'll happily go along with it. In the same way, the massive fear of Ebola spreading everywhere has been a good incentive to invest in controlling Ebola in the DRC and other places. To the first part, I think there are a couple of missteps in the malaria community which I think has led to some of the challenges we have. When you're trying to mobilize funding, particularly when you're trying to persuade politicians to give you money, and in this case, all of US President's malaria initiative comes from the US government. 30% of global fund money comes from the US government. So the US government is the main player, and then you have the UK and others. there's always this sense to eke out every single positive news. So you become very addicted to presenting positive news at the expense of the reality in some instances. And once the reality becomes really hard, it becomes very difficult to flip. To say, actually, we have a problem. You can't tell a politician last year everything was wonderful. This year, we actually have a massive crisis. You have to build that narrative slowly. And so the initial urge to be positive, to raise more money, with the latter facts that progress had stalled, we had dealing with massive problems of biological threats and large expansion of population, has become very difficult narrative to reconcile to make more money available. But there's also the general picture, which is true, that there's just little money available for any major initiative. And so from our perspective, at least when I was in WHO, one of the ways was, look, we now need to be a bit more clever in the way we implement by using information and data and local context to tailor interventions more effectively for impact within the resources we have. And hopefully that allows us, by demonstrating our efficiencies, that allows us to say, you know, we've really eked out every single impact from this. We need more to get us to the next level. It sounds like a simplistic narrative. There's a divide in the community. By focusing on efficiency, you might be saying you don't need more money. But my position is by demonstrating that you can get more money, by demonstrating you've done the best you can with the money you have, you're able potentially to sell a better narrative of getting more money from the course.
I will take one last question online. Paul Borima, do you wanna unmute yourself and ask the question?
Thank you, Fredros. Good evening, everyone. Fredros, no, good evening. Could you shed some light on your thoughts on the nexus between urbanization in Africa and malaria transmission? Because what we see is that by 2040, Africa will be home to at least 12 to 15 cities that would have more than 10 million people. So essentially, the landscape is going to change quite significantly, and we have more people living in urban environments than in the rural areas.
Thank you.
It's a double-edged sword. On the one hand, overall urbanization is likely to decrease malaria transmission. It has to be reasonably well-planned urbanization, particularly when you have a considerable amount of receptivity in most of these areas where urbanization is happening in sub-Saharan Africa. On the other hand, if it's not properly planned, then you could actually start creating pockets of transmission in urban settings, and some of those may become really dangerous if you have an invasive species that's very efficient, like Stevensi. So on the optimistic side, I think more urbanization is a good thing for controlling vector-borne diseases. Malaria, not all vector-borne diseases. I should not tread on the toes of the apoviruses. But for malaria, that's a positive thing, I think, overall. But I think it's about what form of urbanization, how well planned it is in terms of preventing hotspots of malaria transmission.
All right, I know students have class now, so we're just gonna stop, but we can continue talking a little bit. All right, so join me in thanking Noor for the presentation.